So on this video series, we're actually going to talk about arthritis. And to make arthritis, we're going to actually talk about it in two different camps. One, there's a camp called autoimmune disorders, and examples of things that are in the autoimmune disorders would be more rheumatoid arthritis or psoriatic arthritis. For today's talk, we're going to talk more about degenerative joint disease, and that's not an autoimmune disorder. That usually starts from a wear and tear type of injury or something that's happened to our spine over time. And we've all known somebody who's had an old back injury or an old knee injury or something that never was stabilized or corrected properly. And over time, that joint became degenerative. Not because the body's attacking it like you would see in autoimmune disorders, but this is more of that wear and tear we talked about that's due to a joint problem that just kind of wears that joint down over time. So often I get patients that will talk to me and say, how do I know if chiropractic care can help arthritis? Or how can you even begin to help something that's already degenerative? And the answer is very simple. We're not trying to reverse something that's already happened. It's already happened to the joint, but what we're trying to do is improve the biomechanics of that joint. We may not be able to be 100% efficient on pain relief, but if we can improve the movement patterns of those joints, we can actually slow down the degeneration. So here I have an example of what a degenerative joint would actually look like. And let me pull another one here just to show you what norm would look like. Here's two different examples. One here on my left here is actually two vertebrae with a nice thick disc space underneath in between these two vertebrae, nice smooth borders, and this is what a healthy spine should actually look like. But over time, we could actually develop a situation where the discs start to wear away. You can actually see how the discs become thinner in there. And if you look closely, you can actually see spurs that actually start to form around that vertebrae. And this is what we call osteoarthritis or degenerative joint disease. And this condition we're looking at here with this vertebrae is also called degenerative disc disease as well. And this is classic for wear and tear or joints that just worn over time. Now with a lot of these patients, if we can restore movement back to these joints, you can actually slow that progression down. And honestly, the biggest thing that I'm looking for with patients with this condition is to keep them mobile. And when we talk about wellness in general, we're talking about move right, eat right, and think right, but the move right component of that whole thing, chiropractors have a really good ability to help that patient. And if we can get them moving better, get those joints healthier, and get them healing, and then stabilize them with exercises, talk to them about diet and getting their weight under control, there is some great outcomes that can come out of chiropractic care and arthritis. Really look forward to talking to you again on your next series.